pleasure to be with you and every year आप हमें ये chance देते हैं कि आपके साथ कुछ time spend करते हैं. It is actually a great moment for all of us who are clinician here that you give so much love to us. So today we are discussing two topics. One is multi-ligament injury knee and second one is for shoulder. So multi-ligament knee means either two or more ligament of knee are damaged. So we come across with such kind of patients, and this is not a uncommon injury, we all know. But multi-ligament injury sometimes comes to us on day one. Sometimes they came to us after a month. So every time the treatment line is different. So I want to know from all you physiotherapists that what you want to know or what are your perspective for multi-ligament injury so that we can discuss and clear these things.
Sir, as we discussed about multi-ligament injury, so a lot of times it happens with us that the sports person got injured on a field and they visit us. We do some initial treatment for them, rather, I mean, for icing, strapping, give them some rest, and then if we feel that the patient requires an orthopedic consultation, because if in case if the range is restricted, there is too much of swelling, we usually refer them initially to the orthopedic surgeon, and then the necessary things usually proceed that way. And if the patient has been now 1 year, if it has been 1 month that patient has got that injury, then as physiotherapists, we look up that how is the range of the patient, what is the strength of the patient, whether the patient range is improved, does the patient has laxity, and in case if we feel as the because if it's a sport, as I'm discussing about a sports person, in case if we feel that patient has laxity and he requires high his requirement for the his profession as a sports person is high, we usually send them back, because initially when patients are after an acute injury, when they visit us, our goal is first to reduce his pain and swelling, and obviously we will do an initial consultation with the orthopedician as well in case to rule out some fractures, and after 2 to 3 weeks, as you all usually suggest an MRI for the patient in case the patient has injury, we send them back to the orthopedic surgeon for an examination in case if they require surgery, and things proceed that.
So for multi-ligament injury, there are three kind of scenario which we generally feel. First, patient has injury and he came to us within a week. First thing, we means either me or all of you physiotherapists. Second scenario is it's already delayed by 1.5 months. And third one is after surgery. So three kind of scenario are present when patients come to you. So for the first scenario, if the patient came to us within 3 or 4 days or within a week, then multi-ligament injury is such kind of injury that can easily be diagnosed clinically by draw test, and collateral test can be checked by valgus or varus test. So this is easily diagnosed kind of injury. After in those kind of the scenario, they are actually case where we have two plans for them, either keeping them on slab or brace for certain duration, and after 3 week or 6 week we plan for second surgery. But if the injury is significant, then some of the time we feel that all the ligaments which are injured, either two or three, they should be operated in single sitting, and then actually the role of physiotherapy is very much, and we always tell our patient that if you are opting for all ligament reconstruction in single stage, then you have to commit us that you will join physiotherapy, you will follow physiotherapy at least 4 6 weeks. Then only you are able to get good results. If you feel that you are less tolerant to pain or you can't do physiotherapy, then don't jump for these kind of the surgeries. And without physiotherapy in multi-ligament injury, you cannot get good results. It's impossible to get good results if the patient has multi-ligament injury and doesn't go to physiotherapy. Second scenario is when we operated the patient. So that is a dilemma kind of scenario for physiotherapist also, which we always discuss with physiotherapists, because some of the cases are those who are gaining movements very fast and some are very prone for stiffness. And we cannot judge this thing pre-operatively. Mostly if we operate multi-ligament injury, they are prone for stiffness of the knee joint. So for this thing, it is important for us to start physiotherapy 7 to 10 days after surgery. Previously, or we can say after before 4 to 5 years, whenever we operate a multi-ligament injury, we keep the patient immobilized in a brace for 3 weeks and then we start physiotherapy. And because of that, the chances of stiffness are very high. So now we have changed our protocol. We started physiotherapy 5 to 7 days after the surgery, once the swelling subsides, and that is actually the best time to judge the quality of a scar which is developing. So this feedback is given by our physiotherapist that, sir, this patient is gaining movement so fast, and this patient, इसका patient का movement आना तो सर difficult है, it's very stiff. So depending on that thing, we always evaluate patient after 3 to 4 days again. If their movement are easily, then we try to reduce the aggression of physiotherapy, and mainly we keep on muscle strengthening program. But once there is a stiffness, then definitely achieving the range of motion is our first target. Anything else? Any question from your side?
Hello sir, I am Bhubon and I have a clinic called Physio. Sir, there are many a times I have seen that whenever any meniscal or ligament injury patient comes to a clinic, there's a specific band which is present on the anterior part of the knee joint. And I see the band is very tight and the terminal extension of the knee joint and the flexion is reduced. And it is inflamed also. So my question to you was, sir, should we first reduce this, because he doesn't let us check because already he is in so much pain. So my question to you was, should I wait or should we wait and reduce the swelling and then check the knee joint, or should we first start the knee joint, then we plan our treatment, sir?
So evaluation of multi-ligament injury is very easy. That can be done in even in painful stage also. You need not to give the complete stress. Just giving the stress, you are able to know that patient has significant injury. And before treating them, it's important that first aim is to subside. We should wait for subsidence of swelling. Then only we will do all the things later on.
Thank you, sir. Thank you.
Any update from your side, boss?
So, first of all, those who do not know me, I am Dr. Abhishek Gupta. I am Senior Orthopedic and Joint Surgeon at SHALBY Hospital, Jaipur. I am an expert at shoulder and knee, and I am primarily into arthroscopy and sports injuries. So, when it comes to ligament injuries, first of all, as physiotherapists, there are so many scenarios where patients, they do not visit an orthopedic surgeon initially, but they visit you. So what is most important is that you recognize these injuries, because you are the first person whom they trust in. So it's very important that you are well versed with the clinical examination of the knee, and you are not just able to give a good physiotherapy, but you are also able to do some clinical diagnosis as well. Because radiological diagnosis comes later, first is the clinical diagnosis. So this is the one thing that I want to bring in here. So develop yourself as good clinicians first. Also, when a patient comes to you with history of instability, it can be an acute injury, it could be a chronic injury. So try to understand if the patient is not able to bear weight at all. Because if in case the patient is just having an unstable knee, it could be an isolated cruciate ligament or a collateral ligament injury. But if it is not able to bear weight at all, or if even slightest movement is difficult, then there is a strong possibility then it could be a multiligamentous injury. And you should first get it evaluated by a good sports injury surgeon. So that's another thing. Also, the timing of treatment is very important, as Dr. Lalit just suggested, because there is a golden period for multiligamentous injuries. And if you allow that golden period to pass, then the results get compromised. So if you doubt that the patient is having it's a swelled knee, there are contusions, and the knee is grossly lax, it's unstable, then you refer him immediately to a good orthopedic sports injury surgeon and let him evaluate and let him diagnose it in a better way that what kind of a pattern of multi-ligament injuries it is. So there are various grades of multi-ligamentous injuries, and according to these grades and according to the patient's need and other factors, we decide what is best for this patient. So when multi-ligament injuries we come across, we first treat them with the management, the price regime, and then of course we initiate the early range of motion in these patients. So sometimes we go on for one ligament surgery at a time, or sometimes we have to operate all the ligaments or majority of the ligaments in one go. So that is again a clinical decision. So my thing is for you is that identify these injuries timely, get a good referral to a good orthopedic surgeon, and then as a team, you guys can work and decide what is best for your patient. So yeah, thank you.
Any more questions?
Sir, I have a specific question, sir. Sir, because our Rajasthan being a very old city, the houses in the cities, especially, they have shorter and higher footsteps, and especially it's a male-dominated society. There are many housewives who work in those kitchens, and they have a tendency to stand throughout the day. They make breakfast, dinner, lunch, and they stand throughout the day. So they, because of the compression coming at the knee joints, so they basically come with us for two complaints that I have a pain in the medial aspect of the knee joint, and once I put my foot forward, there's a tendency of the foot kind of giving away, especially when I am coming down the stairs. When we get a evaluation done, sir, we can see that there are arthritic changes also, clinically speaking, and there is a complete loss of the medial meniscus, whether it is a bucket handle tear or a complete loss of medial meniscus. So what should be our approach first? Approach first should be first take care of the medial meniscus part, which sadly we cannot, or should we take part of the arthritic part, sir?
So these are the cases where we found that patient has middle compartment osteoarthritis, which is of grade 2, maximum of grade 3, and along with medial meniscus root tear. So medial meniscus root tear is such an entity that meniscus is actually there, but it's not working. So whenever patient bear weight on the meniscus, its root is